Well, let's talk about where we're at in the country with peaks approaching and other areas flattening the curve. I'm joined by Professor Salim Abdool Karim, chairperson of the COVID-19 Ministerial Advisory Committee. Good evening, Prof. Thanks very much for joining us. So we're hearing that the Western Cape seems to be managing well, seems to be through the worst for now. In Gauteng, we're seeing very grim stories of mortuaries making more facilities available, funeral parlours having mobile mortuary vans. Where are your major concerns this evening? Is it Gauteng or is it areas such as the Eastern Cape?
A very good evening, Sally, and to all the viewers. I mean, when we look at the way in which the epidemic has grown over the last few weeks, we are seeing the variability across the provinces. And because the virus rose quite early in the Western Cape, they are now in that stage of what we call the plateau, and for the last 14 days or so they have not seen any increases of any substantial nature. So that's a good sign. And when you look at a 7-day moving average, that's also a good sign in the Western Cape. But as has been pointed out, that's no room for complacency. In Gauteng, we are still seeing a rise. That rise has now slowed quite substantially. It's still too early to say whether it's reaching that plateau stage. We'll know in about 7 to 10 days as to whether it has or not. My concern is that we will still see a bit of a rise. The challenging setting right now is KwaZulu-Natal, where the epidemic is rising quite rapidly. And we can expect, because of the population size in KwaZulu-Natal, that we will see quite a rapid increase in the number of cases, probably not reaching anywhere near as high as Gauteng, because Gauteng has density as a major concern, which is to a much less of an issue in KwaZulu-Natal. So I think it's really the place to look for now as we're going through our various provinces. The next province to come up with rapidly rising cases is probably going to be KwaZulu-Natal.
You speak about that variability, and it's such an interesting issue. I was speaking to the WHO, their regional office yesterday, and we were talking about schooling. And their guidelines are that schools should not reopen while infections are rising. But the point that was being made was that areas that are not badly affected, where infections are not rising, perhaps those schools can reopen safely. I was just wondering what your view is on schools reopening and whether we should be looking at a more nuanced approach. There are provinces that really don't seem to be badly affected at all at the moment, I qualify, such as Limpopo. Should we be looking at a different approach for different areas when it comes to schools at the moment?
Yeah, I think much has been made of the WHO recommendations, but actually when you look at the actual detailed recommendations, they actually talk about very careful consideration of the local epidemic and the local circumstances, and also to consider whether children may be at higher risk or at a similar risk when they are out of school as to whether they are in school. And so when you factor all of that into consideration, the benefits right now of schooling are quite substantial, especially when you take into consideration that children have a lower risk of acquiring the infection and have a much lesser severe form of the disease. But at the end, I think when we think about trying to do it differentially, I'm not sure right now whether there's any part of the country that I would recommend that children should not go to school. I think at this point, even though cases are rising, the actual fraction of infections is quite small. And so at this stage, if the rules are followed and if we make sure we have social distancing and that we follow the protocols that have been recommended for schools, there should really be no concern that children would be at raised risk when going to school.
What about the teachers? SATU and other teachers' union are adamant that schools should not reopen. Do you think that it's irresponsible in terms of the teachers, many of which have comorbidities or are older?
Yeah, I think that the teacher situation is slightly different because comorbidities play a bigger role there. And I think some exceptions need to be made for the more elderly and those with comorbidities. But to date, we've had, in several investigations that have been done, we haven't found clear-cut evidence of transmissions occurring in schools. In fact, most of the infections among teachers in school actually come from teachers bringing it from outside school. And that's going to be a concern. I mean, that's a concern in every workplace. The issue about people coming into a setting, a workplace setting, with infection presents a risk to fellow workers. And there we have to really be careful. I mean, in my own center, we have the same issue, but we have put in place such stringent protocols. And if you follow the protocols, your risk should be minimal.
Let's talk about some hopeful news. Yesterday, the news from the Oxford trial that it was safe. It shows an increase in antibodies and T cells, and they were hoping, obviously they have to do a lot more tests, that they may have something by the end of the year. This is not the only promising vaccine. There are a couple of others. How hopeful are you about the Oxford trial and others that are showing early promise?
I have to say, very excited to see these results. 3 of the vaccine trials released their first in human results yesterday. The Oxford vaccine, which is based on a chimp adenovirus from chimp, the Chinese vaccine, which is using a human adenovirus, an Ad5, which we know quite well, and another mRNA vaccine. So we've got 3 vaccines, all showing pretty good results. The best of those results are probably from the 2 adeno vaccines, but it must be pointed out a couple of things. The first is that these results show that these vaccines can generate an immune response, whether it's cellular or antibody response, and that's a good sign. But we don't know whether that's going to protect against COVID. That question has not been answered. We are hoping that it will do so, but that's why this is a very early stage of the clinical trials. We have to wait until the larger clinical trials are done that will actually answer the question, which is, do these antibody levels, do these immune responses prevent COVID from occurring? So we still have a long way to go. I don't want to create any undue hope that it's going, it's coming in the next few months. There's a long road in vaccines, and this is one of those milestones on that road, which is giving us hope and promise, but we still have a long way to go.
I want to ask you about the latest science and thinking around reinfection. News reports just yesterday, I think it was, from Durban, a woman who was positive for COVID in March, recovered, had a test that proved negative, and then in July tested positive again. Now, I know you don't have the specifics of this case, and one would need to go into the lab results and really delve into all of that. But globally, is there new science, is there new information around reinfections, and if it's possible? In other words, how long might any immunity that we get from contracting COVID last?
Oh, Sally, you're asking the really important question. That's a prize-winning question to answer. So let's look at what do we know. We know that most people who get the coronavirus infection produce antibodies. We also know that in those who have very mild symptoms, they produce a much lower level of antibodies. We also know that in a substantial proportion of patients, that even when they have antibodies, the antibodies start dipping and come to quite a low level after about 3 months. So that's what we know about natural infection. To date, we don't know whether somebody who was naturally infected is protected from a natural second infection, because it's too early to tell. We need whole populations that have now immunity in which the virus runs through them again. In the particular case of Durban, one needs to be very careful of these kinds of anecdotal social media kinds of promotional things, because in reality, when a person gets this virus, they can test positive on a PCR for months on end. In fact, I have patients right now in my own clinic that we are seeing that are now in month 3 and are still testing positive. So when you have somebody who tests positive, then test negative and test positive again, you have to be very sure that that middle one wasn't a false negative result, because that can happen. Either the swab wasn't taken correctly, or it just happened that at that time the test result was negative, but in fact the virus is still present. So it is too early to tell whether that particular case is meaningful or not. At this stage, we cannot answer the question of whether a single infection would protect somebody from getting reinfected.
And that's the truth. Thank you very much, Professor Salim Abdool Karim, always keeping us focused on the science. He's chair of the COVID-19 Ministerial Advisory Committee. Thanks very much.